Welcome to the Reverse Mullet Healthcare Podcast from BP2 Health. Today we are in the studio talking with John Couris, President and CEO of the Florida Health Sciences Center, about world-class outcomes that won't bankrupt the individual. First, who are we? Why are we here? And more importantly, why did we name our podcast the Reverse Mullet Healthcare Podcast?
Well, we want to be relevant, informative, and creative, but we also want to be entertaining and have fun. So it's like a party in the front and business in the back, like a mullet, only reversed.
We are your hosts, and I do not have the wig on, so you can't see it in real life.
With
Ellen Brown,
Justin Politi,
and Dave Pavlik. We are passionate, innovative, collaborative, and are committed to solving some of our industry's most pressing problems along with our clients. We have a combined 90 years of experience.
A bunch of old fogies we are.
Speak for yourself. Although I am actually older than you, so anyway.
Marginally.
Yeah.
Right.
Anyway.
In each episode, we're going to dig into a hot health care topic and potentially dig into each other.
Just don't dig into me. Be gentle, please.
Yeah.
Yeah, no chance.
Right. We'll see about that.
All right. Never. I can try at least. Okay, so I'm really excited to have John back with us for a full episode this time. Back in January, so I have to tell stories, right? Back in January at JP Morgan.
We do only have about an hour, so.
Yeah, it's not that long of a story.
We'll do the Ellen abbreviated version, which means it's 6 hours long.
Yeah, as Justin said, it takes Ellen a while to land the plane sometimes. So I'm going to land the plane quick on this one. So I was at a Centerview Partners event with some very, very impressive leaders in our industry. It was a veritable who's who of C-suite. And I was asking different folks, I said, who do you think are the unicorns in healthcare? Who are the people in healthcare that are actually affecting real change, with all caps, right? Because that's our thing. And your name came up 3 times in that room to me. And this isn't like conversation, going around the room. And I was like, well, now I have to meet this John Couris. And the irony is...
Can you say stalker?
Yeah. So the irony is,
begins, right?
I'm in San Francisco for this event. I happen to live in Florida and Colorado. My daughter goes to school in Tampa. And I'm thinking, how have I missed this, right? I've got it. So then we went back to Vive and we were recording episodes. And I, on the way in the plane, tagged you and said, I want to talk to some unicorns. And John Couris, you're on my list. And we talked and you came on the podcast. And I really enjoyed hearing the innovation that you're working on. And yeah, just kind of the story. And you were like, yeah, I'll come back and talk to you guys. So here we are. So I'm super pumped.
And I will also say that on the way here, on the ride over today, I listened to that podcast. And I remembered that when John walked in the room, first thing he said, we had never met him. She just, by some stroke of luck, he was going to be available and was able to get him to come down to the studio. He walked in and he said, y'all ready to have the time of your lives? We said, uh-oh. Why, yes, we are.
Yeah.
Well, I hope you can top it today.
Yeah, I'll try.
Yeah.
Okay.
All right, fangirl, that's enough. So let's take a few minutes to actually introduce John. He is the president and CEO of Florida Health Sciences Center, which includes Tampa General in partnership with the University of South Florida. Under Couris' leadership, Tampa General's footprint has grown from 17 facilities to more than 150 care locations statewide, including 6 hospitals. He helped launch a venture capital fund, TGH Ventures. He is executing Tampa General's largest master facility plan, a $550 million capital commitment by creating a growing medical and research district in downtown Tampa. He was recently appointed to a 3-year term as a member of the Florida Healthcare Innovation Council. Before joining Florida Health Sciences Center, he served as president and CEO of Jupiter Medical Center in Jupiter, Florida. He also served in
Another link.
Uh-huh.
He also served in various executive leadership roles at Baycare Health and began his career at Mass MGH. So Couris is a graduate of BU
get into that.
And holds a Master of Science in Management from Lesley University in Cambridge, Massachusetts. He holds a doctorate in Business Administration, Management Sciences from the University of South Florida College of Business, where he's a research fellow. His dissertation examined the impact of the practice of authentic leadership on teams and organizations. He is a proud husband and father of 2 children and his professional accolades read like a compendium of who's who in leadership, healthcare, innovation, and thought leadership. Another classic underachiever.
Yes, and just for the record, I had to cut the accolades because it literally, I think, would have taken the entire episode to read them all. So.
It's my staff who wants to list it all out.
So you were in Boston for a long time.
Yes.
All right. Do you know, did you ever see Little Joe Cook at the Cantab?
No.
Who's Little Joe Cook?
He was an institution. Cantab was a Cambridge, Mass bar, and Little Joe Cook was a blues singer, and he was there for years. So, bit of an institution. But
yeah, that's Cambridge, though. That's the People's Republic of Cambridge. It's very different than the city of Boston.
It is. You're that area of Leslie, right near Harvard Square.
Yeah.
Walking distance.
Did you see Harvard Square?
So that's the other one. You like apples, don't you?
I do.
I got her number. How about them apples?
What? Pulls them out.
Goodwill Hunting.
Yes.
Oh. Wow.
Just
saying.
saying.
I got to bring you with me on trivia night.
You would win with this
You
one.
talk about some
would
obscure
actually-
references. Keep going.
You got any more? So
I think we could probably talk all day. St. Patty's Day. Yeah. I lived in Alston, then moved to Watertown Square, Waltham, and then subsequently crossed the border eventually into New Hampshire, to no tax land.
Yeah. I'm from Swampscott, Massachusetts, just to the north of the city by about 15 miles.
You still have family there, or
my whole family's still in New England?
Okay,
most of it. Most of them.
So we're in Salem, New Hampshire now, but
yeah, I know it. I went to high school in New Hampton.
Yeah,
in New Hampton.
Yep,
New Hampshire, right off of Lake Winnipesaukee.
Yep, I
used to live in Lake Winnipesaukee,
Paugus Bay, South Down Shores,
Meredith, New Hampshire. Yep. New Hampton.
Is Goodwill Hunting the Beautiful Mind movie?
No, that's different.
No,
but there is a good Beautiful Mind aspect.
He was looking
solving equations.
There is a Beautiful Mind aspect, but wrong movie, wrong state.
He just likes to bring it up so they can make fun of me.
No,
they make fun of me.
I was trying to make a connection and I screwed it up. I will edit that out potentially.
All right, last bit of the fun. You've hiked Machu Picchu.
I did back in when I was in high school.
And not a repeat item for you.
No, not a repeat item. Not a repeat item.
Check that off the list.
Check that off the list. It was kind of cool. It was a lot of fun. I'm glad I did it. We went up to Huayna Picchu too. So if you've ever been to Machu Picchu, there's the Inca,
proper
city and whatever the town. But there's another peak, and on top of it is a temple dedicated to the moon and the sun. And you can climb up that. It's not a long hike, but it's a very steep hike. That's kind of a neat thing to do. But it's a one and done.
But that kind of probably was the nail in the coffin on that one. The extra steep.
It was the one and done for me.
But so in good news, though, the last time we talked, you were headed to London and Croatia.
Yeah, it was awesome.
Was it? Did it top Rome?
Very different. So I would highly recommend. We went to Croatia, to Dubrovnik, we went to Montenegro, and we went to London. I would highly recommend Croatia and Montenegro. And London's one of my favorite cities in the world. It's wonderful. But Croatia is a definite.
Heard.
If you haven't been, you got to go.
It's high on my list. So I was like, oh, we're going to see John, and I could ask him about Croatia.
It's like a less expensive version of Italy.
So,
but you said you loved Rome. How do you compare the two?
I think they're very different.
Croatia,
Italy is such a special country, and Rome is just this incredible city, as you know. Totally different. Croatia was former Yugoslavia, right? So it's Croatia, Montenegro. They're still developing.
Yeah.
In a crazy way, even though it's been a while since the 90s, they're still developing. So it's very, very different. Yeah. I mean, in Rome, you feel like you're stepping back in time, right?
Yeah.
You really feel like you're.
Well, you are, right?
Right. I mean,
you walk in that Colosseum and you're like, wow.
That's this is like the real deal.
Yeah.
Very different.
Okay. Well, I'm going to have to. You're
going to reel us in?
I'm going to be the guy.
Moving from the party in the front. All right.
I'm going to slide us into to the business in the back part, but I'll do it in a fun way. We took failures. Right? We're gonna talk about failures again. You made headlines when you said we don't do pilots and celebrate failure when you were speaking at the main stage on Vive where we met you. And then we first met. We started to scheming. Should I say scheming? Is that the right word?
I don't know. It has a negative implication, but I'm going to stick with it. It's okay.
We were more spitballing the idea of a failures conference.
Yes. So tell us your thought on that.
Well, I'll tell you it after Monday when I test drive the concept with
Ellen.
I
will be there with you.
Yeah, you will be there.
We'll test driving together.
But Ellen and I are going to test drive it together, and it's going to be kind of neat because we're going to do it on a podcast. We're going to do it with, I think, 100, 150, 200 people in the room. And we're going to go decade by decade about my failures and mistakes. So it's sort of a combination. So it's a mix between a project or two that has completely failed and why, and then what did you learn from it, or what did I learn from it? But then there's also the leadership, mistakes along the way. So I'm excited about doing it. And if it goes well, which I know it will because Ellen is emceeing, I think we should turn it into a conference.
I agree.
Everybody I talk to about a failure conference, even if it's for like 2 days, people love it.
Yeah, everybody loves the concept.
Yeah, I mean, going to a normal conference and hearing about all the good work that's being done around the industry is wonderful and it's important. And those conferences are significant. But literally going to a conference and only hearing about failures and mistakes, I think that's where the deepest and richest learning comes from.
Great.
So I hope Monday will go well and it's well received. And if it is, then we need to make it happen.
We're in.
Yeah. It's going to be great.
You got to find leaders that are willing to check their ego, right? The door, come in and be humble, right?
That's why it's rare to find a leader that celebrates failure.
Well, when I went through all my failures and was preparing earlier this week for next week, I cried myself to sleep after the one session I had with my chief of staff and my vice president of corporate communications, Jennifer Crabtree, who's wonderful.
We love Jennifer.
And I was like, I'm laying in bed. I'm like, I should be weeping right now. But I'm really actually looking forward to sharing it because I think when people don't think they make mistakes or are unwilling to share mistakes, I think that's a huge missed opportunity. I do. And I think there's a ton to be learned. So I'm excited to share them.
I'm excited. I think the other thing too is I've had such an immense respect for your philosophy on failure. And partly it's near and dear to my heart because we have a individual who was a client of ours for a number of years. And honestly, if I had to line up unicorns in rank order in healthcare, but on the traditional side, there's a bunch of really innovative stuff over here that they're point solutions, they're ideas, they're disruptors, but they're not managing the day-to-day of healthcare, the underbelly of it, right? That's a hard place to live. It is a very difficult place a lot of people like to point fingers at institutions and say, you're the reason. This is the system we built. And so we should be much more appreciative of what's happening there. And so this particular individual was probably the most disruptive, willing to take the most bold risks, but calculated risks. And that person ended up, they're not in the industry right now because the bet that they made, the partner that they chose wasn't holding up their end of the bargain. And that really hit, I had a hard time with that. And I think it's important. It's wait a minute though, what if that risk had paid off? That could have been game changing for the industry. And now we lost that person because that one thing, So anyways.
So how do we tolerate or find some level of balance between accountability, right, and admitting mistakes, but then, obviously we want to get people to be encouraged to take chances and risks, but, we have this in our society that, if I do that, then I have a risk of getting fired. And so I'll kind of stay in my lane and not do that. What are your thoughts on that?
Well, I think it starts with like creating a culture that sort of encourages people to take chances and to make mistakes and to celebrate failure and to do the things you need to do. So in my world, it's really simple. We've got 4 key attributes to sort of the world we live in. We lead and treat each other with authenticity. So we are our authentic selves. We don't try to be something that we think the organization or other people want us to be. We sort of embrace who we are, even with all our idiosyncrasies, right? So authenticity creates relatability, and relatability creates trust, right? In a lot of cases. We also lead and treat each other with kindness, right? So we spend a lot of time talking and understanding what kindness is, what empathy is, what love is, and we lead that way. We treat each other that way. As you lead people and treat people and build an environment where people are treated with kindness and love and empathy, you create psychological safety in a really significant way. The third aspect of our work and how we do it, to answer your question, is we lead and treat each other transparently. We share almost everything. The only reason I say almost is because, of course, if there are things that need to be confidential, if it's an employee issue or a team member issue, So if it's a team member issue, if it's a patient issue, if it's a delicate strategic issue, of course, we're going to keep those confidential. But most everything we do, we lay it out there for team members. We hold very little back. And then finally, and that builds trust. That builds big time trust, because no one likes to operate in the opaque. I mean, if you've ever worked with somebody or collaborated with somebody or worked for somebody who isn't transparent, it's a very distracting and limiting. And then finally, we lead with vulnerability. We show real vulnerability, like I don't know something, or I made a mistake, right? Or I asked for help. That's vulnerability. When you start to do these things on a consistent, everyday basis, and it becomes part of the DNA of the organization, you're able to sit in front of hundreds of people and talk about your failures. You're able to talk about your mistakes. Why? Because you know that the organization isn't going to judge you, that the organization will embrace it, celebrate it, learn from it, move on from it, grow from it. So that's how we do it. It's not supernatural. It just is very intentional, deliberate work.
It's the culture you built.
Yeah, it's the culture we built. And believe me, we work on it every single day.
You even have an acronym for it, and you wrote a case study on it, right?
We did. It's called ACTIVE. Great memory. Look at you with your notes.
I didn't even look at my notes. I remembered it. You were talking about it, and I was like, he's describing active.
Yeah.
And I was going to ask him about that later.
Well, what does it stand for?
He just gave you all the words.
It stands for leading with authenticity, kindness, transparency, and vulnerability. And you put those words together and it's active. Yeah. And it's something we train on. So every leader and every team member in the organization is trained on this. We are constantly talking about it and using it and socializing it. We hold each other accountable for it. And in a rare occasion, when a leader struggles with it and gets to a point where you have to make a determination, are they unwilling to adhere to active? Are they incapable of adhering to active? Or is it a combination of both? They got to leave. I mean, we're really very committed to it.
It's impressive. And you did, so I'll just stick with this. I won't, the whole point of this is to be able to have a conversation
Exactly.
But you're so passionate about it. Not only do you lead that through your organization, but you actually wrote a peer-reviewed, like there is a peer-reviewed study on the efficacy of this approach, right? That you published this year.
Well, actually, true. So the active model came from my dissertation and my doctorate program.
Yeah.
So it's a very well studied, very well researched, and there's lots of data that shows that what I'm sharing with the audience actually works. And when people say, well, what does that mean? It works. Well, it has improved team member engagement in our organization significantly. I mean, we operate with team member engagement well above the national averages and in team member engagement. I mean, well above it. Like always, we're always in the top quartile or decile in engagement. It has created an environment of psychological safety. You cannot innovate and create if you don't feel safe in the environment you're doing that in. You can't do it as well as if you were in an environment that fostered all of that. And then finally, it builds trust. And then when you can have an organization that feels safe, feels protected, and you have an organization that's completely engaged, and you have a team of people that trust each other, your performance is, you become unstoppable. See, what's interesting about our industry, I say this to my chief administrative officer who has the strategy group reporting to her. I said, every health system, or most health systems, maybe there's super enlightened health systems in our industry, but most health systems, we think our strategies are novel and they're different and they're unique. They're not. They're all variations of a theme. You travel the country, you talk to all of us in the industry, and we talk about the same things. We're going to build hospitals. We're going to build out an ambulatory network. We have to do more in post-acute. We have to do better with our team members. We have to recruit more physicians. We've got to build more stuff. We've got to expand our footprint. Now, the configurations are different, and there's slight variations to the general theme, but it's basically the same strategy across the country. What is very different from system to system, people, culture, and an organization's ability to execute a plan.
Absolutely.
Very different, very. Our secret sauce in TGH and USF is not the actual strategy. It's our people. I'm biased, but I'm also a realist. We have some of the best people in the industry. I'll put my team up against any team in the country, and we will out-execute any team in the United States.
And so I'll give because I have insider information right now that nobody else knows in preparation of Monday, and see, we have trust. I can see we have built trust because you didn't look at me across the table like, oh, good Lord, what is she going to say? I thought the learning that you had from your decade at Jupiter Medical, I feel like that really feeds into your ultimate commitment to how you lead now.
100%.
Right? I thought that was really telling was I was the one that controlled it. I held on to it tightly. And then when I left, it all fell apart. And so I love sitting here knowing that was in your mind, a failure that now in this next decade, you've done completely differently. I just needed to practice for Monday.
Maybe you could give Bill Belichick some advice.
Yeah, right. No, I did. I mean, the Jupiter experience, just to foreshadow a little bit of what Monday's going to be. I mean, the Jupiter experience was a mistake. I wouldn't characterize it as an out-and-out failure because the institution did extremely well. But when I left, when I was watching all sorts of things unwind, and when one of my board members, because they were coming to me and saying, well, we need help with this. What do you think about this? Or what should we do here? And, I love the place. So I was totally available and willing to help and guide and provide whatever information I could. But I was shocked at how quickly some things, not all things,
right,
but some things just unraveled.
Yep.
And I actually said to one of an old board member of mine, I said, well, what's going on? He said, well, John, and this will be like the cliffhanger. He said, John, you're the leader. We were all on a path that you helped create. You're leading us down the path. And when you left the path, we all stopped walking the path and said, well, what do we do now?
Yeah.
Like okay, so what do we do right now?
Right.
Like we have a plan, but John was our leader driving the plan. We were following
John,
our leader and
not
John.
The plan.
Right. We're following John, and maybe not the plan. Maybe we didn't understand the plan, but we trusted John. And I didn't think, like, I thought I was educating them on the plan. I probably wasn't educating them to the extent that I should have or could have. And it wasn't done intentionally. I thought I was doing it, but I wasn't doing it obviously enough or the right way in that particular case. And so when I left, stuff that was just grounded in great analytics and just good plans changed.
Yep.
And it hurt the organization. And the coaching I got from one of my board members was, well, it's not anything, his comment was, it's not like you did anything wrong. You just made a mistake. You thought these folks were coming along more than they were, and they weren't.
Yep.
Wow.
Yep.
This has given me a new appreciation for, well, I should say my wife is a human resources leader at a large health system in Northern Virginia. And the thing that she's always the most proud of is when they get those engagement scores. And, I don't know if they have something like active, but certainly the pillars, the people
I
pillar.
bet Sarah's going to learn about active whenever you see her again.
I might tell her.
Yeah.
Why not? share the wealth.
Yeah.
But it's given me a new appreciation for what she gets so excited about all the time.
It's all about the people, man.
Absolutely.
Okay. So I am gonna take us to the question, really the platform purpose, the passion purpose of this whole podcast is to bring thought leaders like you, John, to your point, variations in theme, right? But I think what we don't have a chance to do, I think we spend so much time in our lanes and in transactional conversation and in operational details that we lose the opportunity to have true non-transactional conversation about how to affect real change in all caps. And you were cited, I really liked you saying, when we were prepping for this episode, you said, because I have this passion for, I want to see us reverse lifestyle disease. And I'm not talking about prevention and wellness. You and I have clarified that. But I really liked your point of like, hey, I'm doubling down on care coordination. My job is to help you when you are sick. And I think that's a really good line to do. And so you were quoted in a Healthcare Business Today article recently. You were interviewed in part of a thing, and you said, we need to do a better job as an industry on care coordination, patient experience, access, and convenience. And you went on to say, we are creating a healthcare ecosystem that provides a frictionless environment for our patients, physicians, and allied health professionals. Tell us your vision. And if that's not your vision of real change, you can change the topic. But, it's as we push things along, and it can be incremental, but, what's that kind of push to make a difference when people complain about healthcare or whatever?
Well, it's a great question. I mean, we're on an unsustainable trajectory in healthcare.
Yeah, absolutely.
I mean, 17 to 21% of the GDP is spent on healthcare, depending on the year. And it doesn't really go lower. It's kind of stuck there and it inches up. You look at quality, you look at clinical outcomes, you look at the most recent Commonwealth report, which is a wonderful report to look at because it's a it's not a partisan report. It's sort of like just a report on healthcare. And you look at our quality compared to the other 10 or 11 industrialized nations, largest industrialized nations in the world. And there's lots of reasons for this. We're like dead last in almost every quality indicator. Now, don't get me wrong. There's wonderful work being done around the country by really incredible and special health systems, but we're not moving the needle. Health and wellness isn't going to do it. Not in our lifetimes. And maybe never. I think health and wellness is a component of care coordination, but I don't think it's the business that we're in, at least
that's it.
The sector of the business that I'm in.
That point to me is what I always kind of go back to is, and I experienced it with my mom. She actually had almost died a year and a half ago at Jupiter Medical Center. So thank you for the work that you had done because it is a really good facility. And you've taken very good care of her twice. But I walked out of there realizing you go to the hospital to be kept alive. You are acutely ill. You are experiencing an acute incidence of sickness there's something really wrong, right? And you are going to the hospital to be kept alive and to not be sick. The job of the hospital is not to make you healthy. And I think that's where we go kind of wrong as a system, is we really have not built anything for that, to teach people and help people how to be healthy. We expect them to just figure it out, and I don't want to answer that right now, but my point is I agree with you that we have built a system for what it's intended to do, which is you're really sick, we're going to help you, right? And that's your job. Like that's what you're asked to do and you're tasked to do.
That's right. And we struggle with it across the country.
Yeah.
So why would we get into other aspects of the business if we can't figure out the core competency of the business? Why, if we can't figure out the main reason why we exist, all this diversification, and I'm going to be a health and wellness platform. I'm going to be an insurance company. I'm going to be vertically integrated. Well, wait a minute. We don't do the core work well enough as an industry. We don't do that work well enough. And so when people say, well, what is that work, John? It's care coordination. It's coordinating care. It's eliminating friction. It's eliminating silos. It's eliminating that fragmentation that exists in the system and that drives quality down and increases cost. In any other industry where there's friction, where it's disjointed and clumsy, it adds cost and it doesn't create value for the consumer. And so what do other industries do? They fix it. We struggle with that. We do. It's not an indictment on the industry because I'm a product of the industry. I have nothing but a ton of admiration for my colleagues that are trying to figure it out just like I am. I just don't think as a total industry, we've embraced the concept of care coordination.
But most organizations will tell you we do care coordination, we do population health.
Right. So what I mean about care coordination, I wrote about this. It was actually published in a Modern Healthcare magazine in like a 2-part series. We published it in a two-part series. The title was sort of Untying the Gordian Knot of Healthcare. Care coordination's kind of the way. Mm-hmm. Right? And the reason I wrote the paper wasn't because I thought I had great, knowledge to bestow on the industry. It's just that when we started to socialize care coordination at my health system, everybody had a little different idea of it, and they were running off doing all sorts of different things. And I wanted to bring everybody back and focus them. So I basically wrote with a team of people a manifesto that said, this is care coordination. This is our rallying cry. This is our true north. So care coordination to me is not population health. Care coordination to me is a fundamental shift in the healthcare system's operating system. So it's like building an iOS system for healthcare, like Apple has on their phone. And what I tell people all the time, because Apple, most of us can identify with it, I said, what makes Apple great? It's its operating system. It's not the phone. It's not the tablet. It's not the computer. Don't get me wrong. The phone, the tablet, the computer, the earphones, they're pretty cool. They're well designed. They're well constructed. They're fun. They're hip. They're all the things everybody wants. But the stickiness, the reason why people love Apple will tell you this, is their iOS system. It is a closed loop system that both designers and developers and users and consumers coexist. And when you're in the ecosystem, it's reliable, it's safe, it's intuitive, it's friction light or frictionless. It's not siloed and fragmented. It applies sort of a systems thinking to how they deploy it and how people either create in it or are users in it. Why can't we create an operating system like that for healthcare? That's care coordination to us at TGH and at USF.
No, it sounds very, it's exactly what we've talked about in so many different instances of like, you're the type of entity that if I was a payer, and I'm saying a lot of payers have their own like idea of what care coordination should or shouldn't be, and there's a lot of overlap, but why can't I just delegate it to you if you are doing all of this and do it on behalf of all of my members, right? We pay you for care coordination if we all align to say this is the right direction. That's pie in the sky. I get it. But, there's a lot of overlap in care coordination going on.
Because we're all confused in the industry right now. Providers think they're payers and payers think they're providers. Yeah. And then they go, and don't get me wrong. I mean, there's great business models. I mean, look at United Optum. They print money. Okay. You just look at their look at their stock. Look at what they're doing. Look at the money they've accumulated. They do a great job. Now, I don't think they should be in the provider piece. They're in the provider space because they want to retain first dollar coverage as much as they can in their own system.
Right.
They're not trying to save the world. They're trying to build, and they've built a business model that is very lucrative. Okay, that's why they're doing it. Okay, so why not be a payer? And get into health and wellness. Get into the front end of that journey for your beneficiaries, but then help and partner with us as providers. But that doesn't happen in this industry.
No, it's very overlapping. And I think it gets back to the economics. The economics are very misaligned and very disjointed and sort of removed. You don't have a choice. Like, our healthcare dollars are invested on our behalf, right? I mean, I happen to have my own insurance, so I can pick. But it's not like there's some grand plan. There's a limited choice of options, right, of what's going to be covered for me. So our healthcare dollars are invested for us, and they're invested into a system that's to keep me from dying. It's not meant to keep me thriving. That's not the system we've built. And so I think, we need to step up to the plate and own that like, if I want a world-class institution to go to, if I am on death's door or I have something really wrong with me, then I want to go to TGH and know I'm going to get taken care of. And then I'm going to get the best care, and it's going to be coordinated. I'm going to be, you know what I'm saying? Then you're going to discharge me and say, okay, now if you want to get healthy again, go do it. You know what I mean? Like, that's not your role
or partner with people that can do it. I mean, look, we have a really, really great relationship with Florida Blue Guidewell.
Shout out to Lee Bowers, Medicare. Yeah. We love Lee.
Right. Yeah.
Pat Garrity, who's the CEO and the president of the whole thing. Excellent. Great visionary, great guy. His team's wonderful. We don't always agree. There's plenty of times we fuss at each other, but we're great partners because we both kind of believe in the same thing, but look at it a bit differently.
Well, you own your spaces.
We own our spaces. He does, have clinics and does provide care, but he does it in certain markets where it's extremely expensive and he feels like he needs to do something different. That's his prerogative. I think personally, it takes more time and it's more work, but I'd spend more time partnering with health systems and I'd spend more time partnering with folks, but he's a great partner and he's a wonderful guy. We have a wonderful relationship with Florida Blue. We collaborate on all sorts of things. They teach us the payer world. We teach them a little bit of the provider world. We sit down and we try to innovate together. A great example is Pat and his team, Florida Blue. They were the first payer that we had, commercial payer that we had, that actually paid us for hospital at home. That actually started a commercial plan with us, that provided us a commercial plan. I mean, that's great. Those little innovations really, really matter. But again, there's very few of those people out there. I'm telling you, this is just my perspective. It's a little weird. You got, like I said, you got payers wanting to be providers and providers wanting to be payers, instead of sitting down and saying, there's got to be a better way, right?
Right. I'm delivering. And I think, but see, I'll just add that I think ambulatory care is where it gets a little muddy. And everybody's kind of chasing, because to me, that's the area that's a connector, right? Because it's like, okay, I came out of the acute care setting. I'm not ready to just be at home. I've got to enter this sort of ambulatory space, right? Or I'm sick, but I'm not acutely sick, right? And then the problem is that if the health system is just focused on the acute, but they want to be able to feed by using ambulatory, but their focus is on the acute, then they're not going to do ambulatory well. So then the health plan says, wait, I need ambulatory. You know what I mean? So then it gets this like muddy ground. And the sad part is that that's actually where there's a lot of money to be made in whoever's going to own that person in terms of trying to minimize their touching into the hospital system. You know what I mean? Hitting that acute care point. Somebody needs to help navigate that. And that's where I think people overlap. It's like people are bumping into each other. And it comes back to who's financially accountable, which is what I was saying about the economics being.
Well, yeah. And part of it is both sides. Well, on the payer side, basically thinks that, the health system's not necessarily focused on making sure that they're most cost efficient as possible. So we are going to start to deploy resources on our own to do something to help mitigate that, right? And then all of a sudden you have all these barriers put up that the care access that do create that friction, right? So, prior authorizations, all those components that just are hurdles to actually implementing a good model.
Yeah, the federal government needs to create an environment where they bring us all together to really collaborate and build a new model. The way we're doing it doesn't work. And by the way, for those people that think, well, the solution is, a one-payer system, let the government take it over, that would be an absolute disaster.
That's disaster.
That would be a disaster. I have strong feelings around it because, and it's not political. It's just, look, if you look at what Obama did in Obamacare, did it help? Yeah, it probably helped, but it hasn't improved quality. It hasn't improved clinical outcomes or safety. It's increased access, but all he's done is create another pool of underinsured people. Yeah. Okay, so what he's created, it really from an economic perspective, is a bigger burden on the healthcare system because when you're a Medicaid patient, you're paid at some version of a Medicaid rate. In Obamacare, you're just underinsured.
Right, you just don't have.
You're not appropriately insured. Yeah. And when you vilify the health systems and say, well, you're too expensive. Well,
somebody has to pay for that care.
Yeah, but it's ridiculous because it's not the health system's fault.
Right.
Just like it's not completely Big Pharma's fault or the payer's fault. What our government needs to do is create an environment, where you can innovate, you can collaborate, you can partner. How about being incented to do those things to build a stronger and more resilient and more highly reliable system for the people of this country? That's what our federal government should be doing. They should be facilitating this. They should be driving us towards this kind of creativity and partnership. Instead, what do? Our special interest groups run around and we vilify each other.
Yep. I agree.
And nothing gets changed.
I know. And what's interesting is, when you talk about Obamacare, one of the things that came out of that was CMMI, which is the Innovation Center for CMS. And they've launched 50 value-based programs, and we could knock them till the cows come home. And those special interest groups love to bash it, right? It becomes this partisan issue of
both sides. Both sides bash. We want it to go away, and then this isn't saving anything.
But to your point, it's actually a learning lab for new models. And you know what? So what if it didn't save money? If it kept cost neutral, we flippin' learned from it,
That's right?
And so I agree with you that it's we have to invest in collaboration and a realignment. I'm very relieved to hear you say it doesn't work the way it is today, because a lot of health system CEOs are well, I'm doing this or I'm doing that, and it's going to get better. And it's no, we have built a system upon which volume is how you're paid, and you can't fault anybody for that. Why would you want to step up and?
We're given false choices too when it comes to this stuff, right? When I say that, issues are brought up and it's well, to your point, right? Well, we should just be single payer and everything like this is going to go away. No, that's not an accurate statement. Or we need to this whole concept of why aren't we working together in the federal government and sending these everybody to get together on a more functional system versus putting out false choices for people and putting in their.
Be a convener. The federal government.
Exactly.
Convene us, bring us together, drive us.
Instead of driving us apart.
Yeah, instead of driving us apart. No, but Ellen, it's a great point. Listen, under President Kathleen Passidomo's Live Healthy Act, she's created a 15-person innovations committee where we are going to take real problems. I was appointed by her for this committee. We're going to take real problems. We're going to present them to the industry and say, innovate. So venture capital, private equity, entrepreneurs, health systems, OEMs, original equipment manufacturers, companies come to us with a solution to our real problem. And let's let innovation drive the improvements in healthcare that we have to make across the board, I might add, from the provider side to the payer side and everything in between. I'm really excited about
You had me at healthy.
Yeah, well, live healthy.
I understand.
Yeah,
I understand.
But what the President Pasadomo did is she enacted a ton of policy over the last year to improve the resiliency of the healthcare system in the state, along with the governor and along with the Speaker of the House and along with those legislative bodies. They're created a body of policy that is actually going to, if implemented right, and
Exactly.
not morphed into something
And picked apart.
and criticized and all that.
Exactly.
If implemented correctly, it will change the way care is delivered across the state. And I would submit to you that if we can do it in the third largest state in the country, we can do it across the country.
I agree.
Yeah.
I agree. You know, I'll be sending you notes on that one.
You can. I'll
'Cause
keep you updated.
I'm just as excited about that as you are, except I'm not on the committee. So if you could leave a legacy in healthcare, right? If you could leave a legacy, I mean, I think you still have a couple decades left.
I have time. Yeah. I've got a long road ahead of me.
But what would that look like for you? What would feel like the right thing to leave?
It's a great question, actually. When it's my time, let me just set the context. So as a leader, I believe a very simple concept, that the true testament of any leader, anywhere, any industry, anywhere, but in this case, healthcare, when you're ready to leave, retire, move to the next gig, whatever you're doing, and you can look back and you can say, you know what? I left the place that I was responsible for better than when I found it. And now I'm passing the mantle. You've done your job as a leader.
Yeah.
Because leadership isn't about kingdom building and control. As much as people do that stupid stuff, it's not about that. It's not about your ego. We all have ego invested in it. When people say, well, I don't have my ego invested in it, bullshit.
Oh, I know. I just listened to a podcast episode with John Mackey he's the founder of Whole Foods. And it was really interesting to hear his sort of self-actualized versus ego. And I totally agree with you.
Right. So they're full of, people are full of BS when they say, well, there's no ego invested in me.
Yeah.
And we all have a little bit of ego invested in what we do. But that should not be how you measure your success, right? It should be, am I leaving the place that I'm responsible for better than when I found it? And when I pass that mantle on to the next generation of leader, I'm passing a mantle to him or her that's better, stronger, more resilient. So my legacy is I want to leave an aspect of it. I want to leave a system, and I plan on staying where I am until I am done, until I retire, because I'm very committed to what we're doing at TGH and at USF, or in a broader sense, Florida Health Sciences Center, in relationship to what we're doing across the state.
Right.
I want to leave a system that is driving world-class quality, clinical outcomes and safety, that's highly reliable, meaning that there's very little variability in our performance, that it's sustained. So regardless of who you are or where you enter, you're getting the same care at the same level with the same outcomes. And those outcomes are world-class. And I want to do it at a lower cost. And I want to be able to say that not only are we producing these great levels of quality, but we're also doing it less expensively. Oh, and by the way, we've passed that value on.
Right, not just more profitably.
We've passed that, right. We've passed that value on to the consumer, to the patient, to the employer, to even the payer, right? Now, we have to make money. Payers have to make money. In my case, I'm a big private, not-for-profit academic health system. Can't provide care and can't fulfill my shared purpose if I have a padlock on my front door because I can't run profitably. So you got to make money.
Yeah.
Right? But there's plenty of money in the system. My thesis is plenty of money in the system. It's how we use the money that needs to change.
No, I listen. you know that you and I disagree a little bit about the lifestyle disease thing, right? We spend trillions on it. Trillions of that healthcare dollar that should come out is on lifestyle disease. We don't need to have type 2 diabetics running around with kidney failure. And
I agree
you know what I
with
mean
you.
on that. But to me, that's where there's costs to take out of the system. There's a way to do this better, right?
Just because you hit something, but there's cost to take out of the system, and there's a way to do this better. And in my hypothesis is that way is care coordination.
Agreed. I agree.
Right? Like creating for the consumer.
Well, think about it, John, right? People don't know how to reverse lifestyle disease.
Right. No. Listen, we do differ a bit on that, but I believe that health and wellness and lifestyle issues are a part of care coordination. It's just not the centerpiece of who we are.
No, because you're an acute care health system, right? And so I actually agree with you because I think we need a parallel healthcare system. And I think there's plenty of money to go around for that. To your point, we have trillions that we invest in healthcare. And so if there's a system that people can access where they can learn how to reverse their lifestyle disease and not just treat it, like, hey, I'm ready, right? There's plenty of people that want to just keep eating KFC and drinking soda and like that's their
so
shtick,
personal
right?
responsibility with this.
Who doesn't like a hamburger or from McDonald's or KFC? I love it.
Yeah, we're getting ready to record a Hot Ones episode for God's sake.
So I'll throw. Listen, Tampa General, my academic medical center has a McDonald's in it. People will say, "I can't believe you have McDonald's." My attitude is, well, wait a minute. You're an adult, right? Yeah. So you're telling me that you don't have enough self-control to choose whether you want to go to McDonald's or not. So I have to take it away from you? I don't believe in that. If you don't want to eat McDonald's, don't eat McDonald's.
Well, and
now I might say, though, you're going to love this, Ellen. McDonald's has plenty of healthy choices on the menu if you don't want a Big Mac or a Whopper. You can choose healthier options.
Healthier.
Right.
You're just, okay, there's a difference between healthy and healthier.
You can get a salad.
That salad isn't nutritionally dense,
You can get a salad at McDonald's.
Okay,
and if you're in New England, like us.
Can you get some lobster?
You can get a lobster roll in the summertime. Remember, growing up as a kid, that was a summertime favorite at McDonald's. Real lobster in a beautiful bun, toasted, delicious. Even you would like it.
Can you get a lobster roll at TGH is what I think Justin's wondering.
No, a shrimp. There should be some Gulf shrimp or something.
You find a lobster roll.
Yeah, and you said it right. I am not one of those that's the other thing is I don't think idealism is going to get us anywhere. Right? Is being an idealist in all this and trying to be a purist it's not going to get us to your point. We have to convene. And so my thing is like, hey, two things. If we're going to have a McDonald's, then let's have a Bolé. Like, let's just have something. So if I'm stuck in the hospital, I can get something healthy. Let's make it taste good. You know what I'm saying, right? But the other, it's having multiple choices. But the other thing is, having some way for people that when they're ready to make a good choice, they have a way to figure it out. And that's where I think healthcare really does a disservice.
If she was admitted to the hospital, she would be at the farm trying to pick her own vegetables.
Well, some for another time, but I'd love to have you as my guest, and I'll give you the personal tour of our garden. We have a huge community garden.
I've heard about that.
You told us
I'm very
about that.
excited about
Food
this.
pharmacy,
Yep.
primary care attached to the food pharmacy and the community garden. We do yoga, Tai Chi. We have an educational pavilion. We have a sizable farm, and we have a food pharmacy and a food pantry for people. So you come into our primary care office and type 2 diabetic, and the doctor says, you're really only a type 2 diabetic because of your diet. I'm going to give you a 12-week prescription to our food pharmacy. And you're not only going to be able to get food for free, vegetables and all the good stuff, but we're going to teach you. We're going to teach you how to make it and how to process it.
Exactly.
Yeah, we do that.
But the beauty is that, to your point, in the way the system's set up today, you're going to have a padlock on your front door if you go all in on that at this moment in time.
100%.
That's just the bottom line. Right. However, there is...
If you were at risk.
Well, right. But no. And I'm not asking you to become a payer. But if you went to Pat Garrity and said, all right, I got 100 people that I know are your people, and they want to come to my community garden and go to my primary care physician and get healthy. And my healthcare delivery is going to do that for you. And I want a piece of the pie when I do it.
Yeah, you don't get all
That's
the
different than you becoming
fair.
a payer.
No, I
You see
totally
what I'm
agree.
saying?
So I
You know?
look at, if Pat was sitting right here, and he's wonderful, and like I said earlier, his organization's great, and we don't always agree. I mean, we definitely fuss at each other, but we are completely in alignment. You're absolutely right. When people say to me, "Are you going to become a payer? Are you going to go to No, not in my lifetime here."
Right. And I'm not saying you should.
No, but do I want to partner with payers? Do I want to collaborate with them? Do I wish I had that kind of relationship with United and Aetna that I do with the Blues? Absolutely, I wish I had
So do
that.
all of our clients.
I don't. I have a very, very good relationship with Florida Blue, and it will remain very strong.
Yeah.
But yeah, you're right. I don't believe, like a lot of health systems, and they do it for their reasons, and their reasons are their reasons. I not a criticism of it, but I don't understand when a health system wants to become a payer. I don't get it. We don't actually care for patients appropriately. Why would we get into a whole nother business when we can't even do the core business the way it needs to be done? Let's go master that.
Right. Or
there's a lot of Me Tooism going on where you hear stuff and like, oh, geez, they're successful. Why don't we have our own health plan?
That's a great point.
I flew around the country helping people start Medicare Advantage plans because, they went to some Leadership Institute meeting and everybody talked about it and then everybody needed to have their health plan.
You know how hard it is to run one of those things?
Yes.
It is really hard.
We have been, John, that has been the core of our business for many years, is like helping. And to your point, the system is not set up for those models of care to succeed and do well in that. And and culturally it's misaligned. So you have to realign culturally to be so anyways, we could spend
where
another
this brings,
episode.
I know we got to move on, but you know what it brings us back to? This conversation?
Care coordination?
No, if we should have that drinking, like if you ever watch us, whenever you hear this word, take a drink, it should be care coordination over my head. No, but not that we're condoning over drinking, because we're not. We're not. But
it's a healthcare podcast.
Right. We are not. No, drink responsibly. But what it brings us back to is the concept of where the federal government could play a really significant and thoughtful role.
Yeah.
How about being a convener? How about bringing all the elements and the parts and pieces of the industry together to sit down and to really collaborate and rebuild and retool a system? Now, what my critics will say is you're being completely naive and you don't understand the industry the way we think you should. I totally disagree. I know this industry better than most. Agreed. And absolutely as good as some, right? I mean, I know the industry, not perfect at it by any stretch, which you'll find out on Monday. But I'm not
no,
perfect.
but with each decade, you've gotten better.
With each decade, I'm getting better. Like wine.
So,
it's like wine.
Yeah.
But truthfully, I mean, people would say, John, you're being naive and you don't quite understand how complex this is. No, I know exactly how complex it is. And I'm not being naive. What I'm asking people to do is think differently.
Yeah.
It's sort of like the reverse mullet. Think differently, behave differently, not for the sake of it, but the country is depending on it.
Yeah.
If you don't have a healthy and well society, you don't have a strong country, you don't have a strong economy, you don't have anything. And I think there's an opportunity where you get payers and providers and all different aspects of the industry in a room with venture capital, private equity, entrepreneurs, real innovators, and you sit down and say, what does a system look like in a free market capitalistic society? What does it look like?
That meets people where they are.
That meets people where they are, and that is sustainable.
Exactly.
Right? And that's reproducible, and that's highly reliable. The answer is there. It's no question about it. We have to, the lens that we're looking through to see the industry needs to change.
So I have to come up. So you have to help me before the 18th of September. So we have a very quick time frame here. I am now dating this podcast, right? That's
all right.
But I will be up at a Hill Day And it's all about innovation. And I need to have a elevator pitch on what we just talked about today. I have to like re-listen to this because that's what there. I will say at a bipartisan level, there is a desire societally to impact this.
100%.
And so there's a lot of momentum in different places, but I really appreciate that point around convening. That's what we're missing. And
your words helped paint a picture on this white space behind me of what things could look like. So it's very inspiring.
And the thing is, and I'm bringing us in for a landing because we need to.
I know, because we could talk all day.
It wasn't my fault that we didn't land the plane yet.
It wasn't my fault.
We usually close with this question that you essentially just answered, right? Which is, do you have a buy the world the coca moment, or when pigs fly? I think you're convening. I don't want to put words in your mouth, but I think you answered that question. When pigs fly.
I don't know. John looks like he's got to finish.
I think you're right, but I think it's very doable. And you said something, Ellen, that's important. It's not a partisan issue. It's not. It should not be politicized. The health and wellness of the people of this country should not be politicized.
No. Absolutely.
Whether you're a Democrat, Republican, an independent, or however you identify, when it comes to the health and wellness of the people that we are responsible for in this great nation, we should be coming together and collaborating and innovating and building a new model. And not for the sake of building a new model, but because we need to build a new model, because we are on an unsustainable trajectory with healthcare costs and quality. And for the real cynic listening, the budget can't be balanced unless you deal with the Centers for Medicare and Medicaid federally. Right? It can't be.
No.
And so we have to think differently. And
the trust fund's going to go. I mean, the trust fund is going to be bankrupt. So.
And my biggest fear is somebody will come in and do it for us if we don't do it ourselves.
Oh, you're
That's
100%
a fact.
And we
right.
will not like what they do to us.
Oh, 100%.
We will not like it. I don't know what it would be. I could venture to guess, but we're not going to like it.
No.
So right now is our time. It's not 10 years from now.
No,
It's now. And so we got to get after it. So what is my when pigs fly kind of thing? But I do think this is achievable, is when you're up in the hill, it's how do you build something and how do you build a process and a collaborative where like-minded people from different parts of the industry come together to build the new model of healthcare.
Carter will love this.
So it's a buy the world the coca moment. More than pigs fly.
Yeah.
Pigs will probably never fly.
Yeah, they probably
will
never
This is
fly.
achievable.
No. Pigs flew a couple weeks ago when
They did in The Simpsons too.
Well, they also flew a couple weeks ago when Epic announced that people were going to be able to get their own health data into apps as they wanted. That was so. There are pig flying moments. But anyways, all right.
Thank you so much for being here.
Thanks again,
Thanks
John.
for having me.
This is super fun.
Fun.
I know it's rough
Fun.
on a Friday afternoon.
No, it's been great.
We
Thank you.
appreciate it. Yeah. Thanks
Prepping
again.
for you.
Well, I'm Ellen Brown.
I'm Justin Politi.
And I'm Dave Pavlik. We are the partners at BP2 Health. As you can tell, we can talk about this stuff all day. Drop us a line. We might even go down rabbit holes that are not at all related.
Yes, exactly. But we are your best chance for real change.
We are your best chance for real change. Check us out at bp2health.com.
Thank you.
You guys are great.